A few moments later.
I don't feeling well. I feel like tugnaw di siya. Sakit ko katawan. Why ka ba flu? Hindi ako nagtambal. Wala. Lang. 진짜 진짜. Do you want to know more about flu?
Well, flu usually come on suddenly. So people who have flu might feel some or maybe all of these symptoms such as fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and some people may have vomiting and diarrhea, though this is more common in children.
Well, influenza or the flu can easily spread from person to person through three main routes. First is when an infected person coughs, sneezes, or talks, they release droplets containing the virus. And these droplets can land on the mouth, nose, or eyes of people nearby, leading to infection. And second is smaller airborne particles called aerosols can stay in the air for longer periods and travel deeper into the lungs, increasing the risk of transmission in enclosed spaces. And third is the flu can also spread through contact. When someone touches a contaminated surface and then touches their mouth, nose, or eyes, the virus can easily enter their body. And most infected individuals can spread the virus one day before symptoms appear or a week after. They are most contagious in the first 3 days of illness. However, children, immunocompromised individuals, and those with severe infections may shed the virus for a longer time. And in some cases, flu viruses can spread from animals to humans, particularly through direct contact with infected birds or pigs or their contaminated environment. Now that we know how the flu spreads, we can take steps to protect ourselves and others. But how?
Every year, the flu affects millions of people, but the good news is we can take steps to protect ourselves and our communities. Here's how. According to CDC, Center for Disease Control and Prevention, there are 3 ways to prevent flu. First, get vaccinated. The flu shot is the most effective way to prevent severe illness. Health experts recommend getting it every year. Second, practice good hygiene. Wash your hands regularly, cover coughs and sneezes, and avoid touching your face to stop the spread of germs. Third, stay home when sick. If you have flu symptoms, rest and recover to prevent infecting others. Now, for the public health efforts, there are also 3 ways we can do. Number 1 is vaccination programs. Governments and health organizations offer free or affordable flu shots to increase immunity. Number 2, awareness campaigns. Educational efforts help people understand flu prevention and when to seek medical care. Number 3, global monitoring. Agencies like the WHO track flu strains worldwide to improve vaccines and response efforts. By taking these simple steps, we can reduce flu cases and protect those around us. Stay safe and stay healthy.
Management and treatment of flu. The flu is managed through a combination of self-care, antiviral medications, and medical interventions when necessary. Rest, hydration, and fever-reducing medications like acetaminophen or ibuprofen help elevate the symptoms. Prescription antiviral drugs such as oseltamivir, Tamiflu, and zanamivir, Relenza are the most effective when taken within 48 hours of symptom onset, as they can reduce illness severity, shorten recovery time, and lower the risk of complications like pneumonia. While most healthy individuals recover without a medical intervention, those at higher risk, such as people with asthma, diabetes, or heart disease, should seek prompt medical attention for early antiviral treatment. Supportive care includes drinking fluids with electrolytes, eating light foods, and using cough drops or lozenges for throat relief. Preventive measures such as frequent hand washing and wearing masks help limit the spread of the virus. Since the flu is caused by the virus, antibiotics are actually ineffective and should not be used for treatment. Medical attention is necessary if symptoms worsen, such as difficulty in breathing, dehydration, or persistent fever. Infected individuals should actually stay at home until their symptoms improve and they are fever-free for at least 24 hours, without fever-reducing medication to prevent spreading the illness to others.
The role of government policies and public health leadership. Government policies and public health leadership are essential in supporting and amplifying health promotion efforts. Here's how. First, funding resource allocation. Government agencies provide funding for flu vaccine, research and development, distribution, and administration. They also support public health programs that promote flu prevention and control. The second one is public health campaigns. Public health departments conduct large-scale public awareness campaigns to educate the public about the flu, its risks, and preventive measures. These campaigns often utilize various channels, including television, radio, social media, and community events. The third one is policy implementation. Governments can implement policies that support flu vaccination, such as mandatory vaccination for healthcare workers or school children, with appropriate exemptions. They can also enact policies that encourage sick leave, enabling people to stay home when they're ill without fear of job loss. Fourth one is surveillance and monitoring. Public health agencies continuously or consciously monitor flu activity to track outbreaks, identify circumstances, access the effective of prevention measurements. By understanding the importance of health promotion and supporting strong public leadership, we can collectively reduce the impact of the flu and protect our communities. Get vaccinated, practice good hygiene, and stay informed. Together, we can make a difference.